A sharp political clash erupted in Washington as Democratic Congresswoman Rosa DeLauro confronted Secretary of State Marco Rubio over the United States' response to the growing Ebola outbreak. During a congressional hearing, DeLauro accused the Trump administration of dismantling critical global health infrastructure and abandoning American personnel working in dangerous outbreak zones. She warned that years of preparation and investment made after the 2014 Ebola crisis are now being undermined. According to DeLauro, the United States previously invested more than $160 million into specialized treatment facilities capable of safely handling Ebola patients and other infectious diseases. However, she claimed the current administration is blocking those facilities from receiving infected Americans, despite asking U.S. personnel and aid workers to operate in high-risk regions overseas. DeLauro criticized what she described as the administration's decision to dismantle international partnerships, laboratories, supply chains, and health networks that were originally created to stop deadly diseases before they spread globally. She argued the White House prepared for failure, warning that the consequences are now becoming visible. Secretary of State Marco Rubio strongly defended the administration's response, insisting the United States acted faster and more effectively than during the 2014 Ebola outbreak. Rubio stated that Washington had already mobilized more than $200 million in emergency support and rapidly coordinated aid delivery to affected regions. He also revealed that the United States is establishing a special medical observation facility in Kenya for Americans potentially exposed to Ebola. According to Rubio, infected individuals would later be transferred to advanced treatment centers in Europe or possibly the United States. The secretary emphasized that the administration's new foreign aid strategy focuses less on the amount of money spent and more on achieving measurable, long-term results. Rubio said the United States has signed more than 32 global health agreements aimed at helping countries build their own sustainable healthcare systems instead of remaining permanently dependent on foreign aid and outside organizations. The hearing intensified when DeLauro demanded to know who exactly is leading the Ebola response effort. Rubio acknowledged that multiple agencies are currently involved and confirmed discussions are underway about appointing a dedicated coordinator to oversee the crisis full-time. He explained that the outbreak initially spread in a remote and unstable conflict zone, causing delays in early reporting and complicating international response efforts. Despite political disagreements, officials warned that Ebola remains a major global health threat, requiring rapid coordination, international cooperation, and strong emergency preparedness. The exchange highlighted growing debate inside Washington over America's global health strategy, foreign aid priorities, and the government's readiness for future international disease outbreaks.